Hello, I'm Dennis Neal here at the 5th International Vatican Conference, and we're speaking with Edward Tenthoff about the promise of CRISPR. Thanks for being with us. First, let's just talk about the Vatican Conference. Many conferences are very narrow and specifically focused. This one is really broad-based. How is that an advantage?
Absolutely. Well, it's such a pleasure to get to be involved with the International Vatican Conference. And I always want to thank the organizers for putting on just such a special and unique event. I think this is actually the fourth time I've been able to participate. So it's a real honor. And each one has been different and really grown as the field of healthcare and biotechnology in particular has advanced. And a couple of the things that I really enjoy about this conference is, firstly, it's really about the cutting edge of potential cures and novel treatments for really devastating diseases. So every time I come to the conference, I learn a lot of new things. One of the other things that I think is really valuable about this event is it takes people from all different areas and brings them together to really discuss these important issues, whether they're people from the regulatory side or government or even students. Certainly physicians and people like myself in finance are probably in the minority. So it's really just a super unique set of people. And every year I learn from the conference. I hope I get to kind of share a little bit about what we do and the role that we play in the healthcare ecosystem.
So you just interviewed a CRISPR expert who talked about the first 10 patients to receive this therapy have had a total loss of all of their symptoms. They're almost cured: sickle cell anemia and thalassemia. What do you see as the next disease targets for 2021 and beyond?
Yeah, absolutely. So CRISPR Therapeutics, which is a company that we work with, and Sam, the CEO, is a very good friend, is truly transforming medicine. And they're using this CRISPR gene editing technology very prudently and in very targeted ways to have impactful therapeutic applications and interventions. And in the case of beta thalassemia and sickle cell disease, as you mentioned, they've literally achieved cures of these patients who have been treated. So really profound, durable results that are changing these people's lives. One of the areas that Sam mentioned is oncology or cancer, where they're using gene edits to actually improve donated immune cells, which are called CAR T, to actually fight cancer. And that's a hugely promising new field. Another area is regenerative medicine. So here they're actually using CRISPR technology to treat diseases like type 2 diabetes. And I think maybe the most profound area could be orphan diseases. So these tend to be diseases that are very rare genetic conditions, oftentimes very severe, either shortening life or really making life very debilitating for patients. And the potential to impact these genetically caused orphan diseases could be profound.
Right. And what other companies do you see in pursuit of CRISPR therapies? And what's the biggest challenge they face in trying to raise money to finance the research?
The fortunate thing is it's been a very, very strong biotechnology market. So there's been a lot of capital out there to really fund innovations. There's a lot of public and private ventures that are working in the CRISPR-Cas9 areas. And believe it or not, there's other Cas, so there's other ways to do gene editing. Two that we cover are CRISPR Therapeutics, CRSP, and also Vertex Pharmaceuticals, VRTX, which is CRISPR's partner and has other efforts on their own. So both of these are good ways to look at investing in CRISPR, and we have overweight ratings on both of those names.
All right, that's a wrap, and thank you for being with us today, Edward Tenthoff.
My pleasure.